have had a kidney stone say it is the worst pain they have
Yeah.
ever had.
And while they are more common among people in middle age, local pediatric specialists say the number of children suffering with kidney stones has been on the rise over the past several years. Dr. Frank George here with the reason for that increase and also what parents can do about it. That's
Kim,
awful.
It is terrible, actually. I mean, the pain is unbelievable. So kidney stones are solid collections of minerals that can range in size from a pencil tip-sized grain of sand all the way up to really what looks like a plaster cast of the fluid collecting space inside the kidney. That intense pain actually comes when the smaller ones, like sand or gravel-sized, actually pass out of the kidney, and it is becoming a larger problem in kids.
We are actually seeing an increase in kidney stones in children. There's been a 10% increase every year over the last decade or so.
Dr. Kate Kraft is the chief of pediatric urology at University of Michigan Health C.S. Mott Children's Hospital. She says one reason behind the increase is kids aren't drinking enough water.
Water is like medicine for kidney stones and dilutes those minerals that are in the urine that form kidney stones. So by increasing fluid intake, that prevents stones. We also have seen a rise in kidney stones due to increased salt intake. So ultra-processed foods have a lot of sodium, which affects how much calcium is in the urine. And since calcium is the primary component of kidney stones, we see that when children eat more salt, then they are at higher risk of stones.
Kraft says another reason for the rise in pediatric kidney stones is increased use of antibiotics affecting how the gut absorbs calcium and oxalate. If kidney stones are left untreated, they can cause serious pain as well as urinary tract infections and kidney damage. Kraft says parents play a huge role in preventing kidney stones in their children.
First thing they can do is to help their children drink more fluids, making sure that they eat healthy meals, reducing ultra-processed foods in their diet, eating out less, and cooking more at home with reduced salt will all help in kidney stone prevention. And then also being good stewards of antibiotic use and trying not to overuse antibiotics as well.
Now, in addition to causing pain, mostly in the back, other common symptoms with kidney stones that should send you to a doctor right away include blood in the urine and burning with urination.
Now, are there some people that are just more likely to get kidney stones than others?
Yeah, there are people that are genetically predisposed to get kidney stones, and there are some medical issues that can also predispose someone to get a kidney stone. But the fact is, anyone can actually develop a kidney stone. In fact, about 1 in 10 people will get a kidney stone at some point in their life.
So painful.
Unpleasant. If you've ever talked to anybody who's had one, it just sounds
For
like the
adults,
worst
and imagine
thing.
for kids.
For kids,
Exactly.
I know. Terrible, terrible.
Oh,
Yeah.
all right, thanks, Doc. Sure.